The sacrum is actually a fusion of 5 bones, okay? 5 vertebral bones fused together to form the sacrum. Coccyx is a fusion of 4 bones, very small, but 4 bones fused together to form the coccyx. So here, if you see the sacrum, 5 bones, 1, 2, 3, 4, and 5, fused together, and these foramina, anterior sacral foramina, are actually, you could think of them as intervertebral foramens, the openings, because nerves from the spinal cord, spinal nerves, come out from these, just like in the vertebral column they came out from intervertebral foramens. Here they come out from these foramina. The cavities here, they're called the acetabulum. The acetabulum is just like the glenoid cavity or the glenoid fossa, but it's not called glenoid. Glenoid was in the scapula for attachment of the head of humerus. Acetabulum is in the pelvis for attachment of the head of the femur. So the femur's head would come here and attach in these areas here. Okay. Here. Next, if you look at the os coxa, ilium is this big region here. It contains the iliac crest, the top. You can feel that on yourself. Iliac crest. Then there's a fossa here, iliac fossa, here and here. And then there's these 2 protrusions, anterior, because we're looking from anterior view, anterior superior and anterior inferior iliac spines. You can feel the anterior superior iliac spine on yourself. Okay, and then here we have the pubis, and the pubis contains a pubic tubercle, also site of muscle attachments, pubic tubercle, and then there's a superior and inferior pubic ramus. The inferior pubic ramus is continuous with the ischial pubic ramus, and so we call this together ischial pubic ramus, ischial ramus with inferior pubic ramus, together conjoint ramus. So the ischial ramus, about starting here, continues backwards and will form the ischial tuberosity and ischial spine, which we will look at now. So here is the view of the pelvis from the back, the posterior view, as you can see. So here's the iliac crest. On the anterior view we saw there was anterior superior and anterior inferior iliac spines. On the posterior there's also only a single posterior superior iliac spine. Then when you come here, so this is the back view, pubic symphysis over there, sacrum, coccyx, 5th lumbar vertebra, 4th, 3rd. Here is the pubis. Pubis should be in that region, superior, inferior pubic ramus, and then ischial ramus, forming conjoint ramus together. Ischial ramus continues back and forms the ischial tuberosity. Very big structure here. And that then continues to form the ischial spine. So the ischium contains the ischial ramus, tuberosity, spine. You can see here, there is like a notch here, and a notch here. This notch here is called the greater sciatic notch. This notch here is the lesser sciatic notch. It is called the median sacral crest. And then there's an opening that leads into the sacrum, that's called sacral hiatus. And again, you see the foramina, because we're looking at it from the back view, it's called the posterior sacral foramina. There's a canal leading into the sacrum from top, called sacral canal. And because sacrum is a fusion of vertebral bones, 5 of them, the most superior will articulate with the 5th lumbar vertebra using its superior articular processes. Just like the normal vertebral bone has superior articular and inferior articular process, this portion also has superior articular process.